All right, so we'll get started. So thanks everyone for joining us, for spending your Saturday afternoon online. We're thankful that you're all here to learn about what we feel is a really important topic. I'm Emily Legrand, and I'm hosting on behalf of Transition Wolfville area and the Climate Circles of the Annapolis Valley. And first, I'll just acknowledge that we're gathering on unceded ancestral territory of the Mi'kmaq people. I also want to thank Extinction Rebellion for hosting or being a co-host. That's Jillian supporting us in the back, making it all possible. And then, of course, to our panel, most of whom come from Basic Income Nova Scotia, which is sort of our own advocacy group for this topic. I also want to just point out that if you're anything like me, we have a lot of meaningful discussion that we're going to have over the next maybe almost 2 hours. So I really encourage you to take the time that you need right now to find your fidget activity. So whether you want to get a notebook and write down the parts that really make sense to you, or get your knitting out or your coloring book, but whatever will keep your stimulation to an optimal level so you can really take this stuff in over this period of time. That makes perfect sense. And you're welcome to turn your video off and fidget to your heart's content, whatever you need to do, it's all good. And so what we're gonna do today is we're gonna hear from 6 different people who have different perspectives on this idea of a universal basic income. And they're all gonna, just to help focus our attention, we're gonna do a question focus so that we're clear what we're listening for. I know that really helps me. So just to go through the sort of conceptual arc of what we're gonna be listening for, we're gonna have Elizabeth K. Raining-Bird talk about what is a basic income and why is it a vital idea for now. And then we'll have questions. So the way that we'll do questions is if you have a question, please write it in the chat box, and then Jillian, who's our web person extraordinaire, is going to be sort of making note of all of those questions and sort of seeing if there's commonalities or a question that really gets to the heart of it. And then she'll ask 1 or 2 questions to the person who had just been speaking. Each panelist will get 10 or so minutes, and then we'll do 5 minutes for questioning and digesting their ideas. And then, so that's how it'll flow. And then we'll hear from Pierre Stevens, who's gonna discuss how will we pay for a basic income. We'll hear from Wayne McNaughton, who's gonna help us grapple with how a basic income differs from other forms of income assistance. And we'll hear from Karen Faulkner, who's gonna discuss what a basic income would mean for Nova Scotia, especially rural Nova Scotia. And then we'll hear from Jennifer Brady, who's going to discuss how a basic income affects determinants of health and food security. And finally, we'll hear from Pauline Raven, who's going to help us get fired up and clear on how we will get from informing people about the importance of a basic income to actually getting one implemented. And then we'll have time to finish, if we need to, mapping out sort of the advocacy landscape and opportunities that are available right now that you could get involved in if this feels compelling at the end of listening to this information. And then we'll wrap up with any closing thoughts, and we'll be done hopefully by 4:45, definitely 5 o'clock. So that's how it's gonna flow. And now I'm gonna ask Jillian to click the slides so I can tell folks about Elizabeth or Mandy. Yeah. Oop, there we go. Back up to the top, please.
Oh, sorry.
That's okay, I'll get mine up. All right. So we're going to hear from Elizabeth, who's going by Mandy K. Raining-Bird, and she's a speech-language pathologist and a professor at the School of Communication Sciences and Disorders at Dalhousie. She's interested in the undeniable impact of poverty on health and child development. So she thinks that for far too long, society has focused upon relieving the symptoms of poverty rather than treating its root cause. A basic income is a root cause solution to poverty and its associated health and societal impacts. That's why Mandy co-founded the Basic Income Nova Scotia in 2015, and it's why she continues to educate and advocate for a basic income as the chair of Basic Income Nova Scotia. So I'll turn it over to Mandy, who has some slides for us as well.
Okay, thank you very much. I'm going to, can you stop sharing your screen now, please, Jillian? Thank you. I have my own I need to share my screen. Wait just a second. My problem is that I'm having a hard time. Wait a second. I apologize. I'm having a hard time changing it.
You seem to be on, Mandy.
Yeah, but I wanted to make it a
Would you like me to share your slides and you can just tell me next slide whenever you want to change it, or are you okay?
Well, can you see my slides? I didn't really want to have the side panels there, but I'll just move through it like this. This is
if you click the bottom right, I think you can make the very bottom right.
Very bottom right corner.
Keep going to the right.
Keep going to the right.
Yeah, all the way. That one. Yeah. I think that should.
Yeah.
No?
Oh, there we go. Okay, now it let me do it. Before it wouldn't let me do it. Okay, I apologize for that. So I want to thank Transition Wolfville Area and Extinction Rebellion for having me and other members of Basic Income Nova Scotia present on this, I believe, very timely topic. And without further ado, I'll begin. So can you see the screen well?
Yep.
Okay. So I wanted to start out my presentation with a couple of cases. And I think that if you look at these cases, you might recognize the situation of people that you know in them. So this first person, or these first people, are Lorelei and her daughter Susan. And Lorelei had a job as a checkout clerk until recently, and then she quit her job so that she could spend more time with her daughter because she has mental health challenges. And Susan is doing unpaid work while she's on the wait list for housing. Lorelei has little entitlement to benefits under the Canada Pension Plan because of her work history. So she's going to, it looks like, be living in poverty at this point in her life. Pete is another person you might recognize. He worked in the oil sands in Alberta, and with the layoffs that occurred there, he returned to Cape Breton, and he's been unable to find a full-time job since his return, and his EI has run out. So Pete also is falling into poverty at this point in time, and so is his family after having had a history of a well-paid job. So we at Basic Income Nova Scotia believe that poverty is a violation of human rights and common decency and should not exist. And the basic income is a strategy for eliminating poverty. So let me talk about a basic income a little bit more. First of all, you should be aware that basic income is discussed in a variety of ways, and Basic Income Nova Scotia believes that we need to embrace a certain set of principles in order to have a basic income that will really work for individuals and society. And the type of basic income we embrace is one that is an essential component of the social safety net. It will not replace the social safety net. And in fact, there are various components of our social safety net that will need to be strengthened along with instituting a basic income. For example, all of you can probably agree that we don't have adequate mental health services in Nova Scotia, and it would be a good idea for those services to be improved, even with a basic income. So one of the first things that Basic Income Nova Scotia did was to develop a definition of a basic income, which we believed in, and a set of principles that we believe should be embraced. And every time we talk about a basic income, we feel it's important to discuss this. So our definition of a basic income is that it is an income that ensures the recipient has enough money to meet the necessities of life, including food, clothing, shelter, and other resources that facilitate social engagement, such as access to travel and a means of communication. A basic income would be paid to individual adults. The amount will be based upon an agreed upon level of poverty. And there's a variety of levels of poverty or poverty definitions that is beyond the scope of my discussion here. But we could say sort of generally that while a basic income would vary according to where you live, it probably would average around $20,000 a year. The principles of a basic income that Basic Income Nova Scotia identified were the following. First, autonomy. That means it has to be accessible to the individual. And this is important because, for example, if you have a married couple and one of those individuals is being abused, a basic income would follow the individual and allow them to live and meet their basic needs and escape abuse. So that's just one example of why autonomy is important. Another principle is universality and unconditionality. So a basic income would be applied to everybody. It's not, we don't differentiate between the deserving and the undeserving people in our society, and I'll talk about this a little bit later in more depth. In our society, we tend to identify certain people as deserving help and other people as less deserving of help, but a basic income suggests that all people deserve help if they fall into straitened circumstances. And it also is applied with no means testing. So there isn't this onerous application process that gets repeated over and over again. And that certainly exists currently for a variety of supports that exist within society. Another principle is dignity. And so a basic income is an income that is sufficient to lift people out of poverty, so above a certain level, agreed upon level of poverty, as I mentioned before. And if you're lifted out of poverty, you can live a life of dignity. A basic income also needs to be a universal responsibility. So we believe that both the federal and provincial governments need to work together to institute a basic income, and that a basic income will involve an income redistribution through a progressive taxation system, a more progressive taxation system than currently exists. Another principle is economic integrity. It needs to be financially viable, and certainly Pierre is going to talk about that in some depth. And a number of studies, as he will discuss, have made it very clear that we can afford a basic income. And certainly where there's a will, there's a way, as we can see in this pandemic.
Okay, can you hear me now?
Yes, Wayne, you're on now. You need to mute your
in,
mic.
okay.
For,
I'm hanging up.
Yeah, that's great. Welcome, Wayne. So economic integrity or financial viability is possible and is critical. But a basic income, again, cannot exist in isolation. We also have to have other laws and policies that ensure that the basic income isn't siphoned off into greedy pockets. So living wages, rent caps, tuition caps, these sorts of things also can accompany a basic income to support all people in society. And the last principle is one of social integrity. And this means that a basic income cannot, as I said before, replace the current social, many of the current social programs and supports that exist, such as healthcare, disability supports. It has to be part, as I mentioned before, of a comprehensive social network that supports all people. So now that I've discussed a bit about what we at Basic Income Nova Scotia believe are essential components of a basic income, I want to talk a bit about why it's of critical importance. So there are people who need to mute their microphones because we can hear them. Okay, thank you. Okay, so we in society are used to some people being poor, some people teetering on the edge and falling into poverty quite easily. So these groups include the homeless, those on social assistance, the precariat. This is a term that's used to refer to an increasing number of people who are non-unionized, poorly paid, part-time, contract, self-employed, seasonal, or gig workers. The gig economy is another term that's being used a lot these days. And a lot of people might say, well, maybe they deserve to be poor. They could get a job. They could get a better job if they don't have a good job. They should try harder. They could do more to help themselves.
Hi, Mandy. That was my 10-minute timer. So you can wrap key ideas in a minute or two. That'd be really great.
Okay, well, I'll try.
Sure. That's all we can do. Thanks.
Okay. We can expect more precarious, not less precariousness as time goes on. And these are just some examples of ways that workers are going to be replaced that you can recognize. We are used to in society giving inadequate help to those who do fall into poverty. So in Nova Scotia, a very recent publication by CCPA has shown that 24.2% of Nova Scotian children and families live in poverty. 1/4 of Nova Scotian children and families live in poverty. And this is after decades of efforts to reduce poverty. So that's not working. What we're doing is not working. And some are much more impoverished and much more vulnerable than others. And this right-hand figure shows you some of those groups. And poverty is racialized. So African Nova Scotians and Indigenous Nova Scotians are experiencing poverty much more than the average Nova Scotian. And social assistance and minimum wage are inadequate to provide a subsistence that's above a poverty level. And so these boxes indicate on the left-hand side how much a single person who's considered employable would receive at the top with social assistance, and at the bottom, how much they would need to not live in poverty. So that's ridiculous. That's $10,000 less per year than they require. And the same, if you look on the right-hand side, you can see that people who are working full-time on minimum wage, it's only a single person who has no dependents who could actually meet the poverty line on that wage. So that also, and that's with the 11.55 or $11.55 an hour minimum wage that was instituted recently. And we pay for our neglect. The damages poverty causes to human beings, life chances, to communities, and to social and economic productivity and progress are clear and cannot be ignored. Poverty is the best predictor of early illness, early hospitalizations, longer hospital stays, and earlier death. It's a reliable predictor of substance abuse, food insecurity, as Jen will talk about later, poor education outcomes, and for some, trouble with the law. This is a statement made by Hugh Siegel recently when he was designing a basic income for Ontario. And it's all based upon research. We feel some people deserve our help more than other people. The Canada Child Benefit and support for the elderly is proof of that. This pandemic has taught us, however, that almost everybody can fall into poverty through no fault of their own. I would argue that there is never fault when somebody falls into poverty. Under this pandemic, governments are helping. You're all very aware probably of the CERB benefit that exists. Is this a basic income? It is in some ways very similar to a basic income. It's a taxable income. It can be administered through the tax system. You must apply and meet criteria, but the application process is relatively simple. But there's gaps that exist. So there are, again, these deserving and undeserving poor, and it's temporary. It's only going to last 4 months. And it's only instituted in a crisis, and we need something that is more proactive rather than reactive. As you all know, we're in a climate crisis as well. Climate change means more pandemics. Transitioning to a greener, less polluting, more sustainable economy will mean that people are going to lose jobs. Just think about some of the things that are happening across the country and here in Nova Scotia now. In this transitioning to a greener, less polluting economy, we need to reduce consumption. We need to link the health of our economy to the health of our people, and a basic income would help. A basic income will be there whether there's a crisis or not. And a basic income will help support people in a variety of ways. All work is valued, people have economic security, people can take risks, people have choices, and there's research that shows that it has a positive impact in a wide variety of ways. So just to wrap up, the old normal is no longer acceptable. A basic income is an important part of a permanent solution. So seize the day and let's have a basic income now. Thank you very much.
Thank you so much, Mandy, for starting us off. Maybe I'll turn it over to Jillian.
Sure. If we have time for a question, we have one that's come in on the chat. And it's, is there any meaningful difference when you hear a guaranteed annual income versus you hear a universal basic income? So there are different terms, I think, that are related to this concept. So the question is, do they all mean the same thing or do they mean different things?
Well, as I said at the beginning of my talk, the term basic income or universal basic income can mean the same thing, or it can mean a variety of things. And that's why we think it's so important that we define a basic income and define the principles that we feel need to describe a basic income. And so just to go back to my beginning slide, these are the principles that I think and Basic Income Nova Scotia members feel are of critical importance. And I should probably also say that these principles are embraced by Basic Income Canada Network and other advocacy groups across the country. So this is not something that that we've dreamed up that is not shared across the country.
Okay, I think we could probably go on then, Emily.
Yeah,
Okay.
I agree.
I need to stop sharing my screen, right?
Yeah,
Okay, there you go.
thanks. Thank you so much. Okay, so we'll shift gears to listening with Pierre Stevens. Pierre, are you all tech ready over there?
I would like to share
Okay,
my screen too. So
yeah.
if
Well,
I
you figure out how to do that, and I'll do a little introduction for you.
Thank you.
Sure. So Pierre has retired from Dalhousie University. He taught there for 35 years in the mathematics department. He also grew up in the Netherlands, where he benefited from a government-funded post-secondary education. So he has personal connection with aspects of this topic. He's currently the treasurer of both Basic Income Canada Network and Basic Income Nova Scotia. And he's a co-founder of Basic Income Nova Scotia. And he's guided by his belief that every human being has the right to a fair standard of living, and that as a society and as a community, we have an obligation to make this possible for everyone. And he's going to touch on perhaps everyone's first and favorite question: how do we pay for a basic income? So I'll turn it over to you.
Okay, thank you all, and nice having you all here. And I'm surprised that this is the most interesting question, you know, but I'll try to sort of go through it without sort of, let's say, without hopefully not losing too many people. So first, I want to talk a little bit about what we have learned from COVID in terms of a basic income. And if we look at what the federal government did in terms of CURB, we see that, you know, Mandy already mentioned it, the $2,000 a month for people who, for no fault of their own, have lost income. Now, why did the federal government does that? Because they basically are acknowledging that a basic income builds resilience into the economy. In other words, people need money to be able to sort of, let's say, keep the economy going. So a basic income has been recognized and identified as essential. The second one is what we've learned from the COVID-19 is that the federal government is seeing $2,000 a month or $24,000 a year as the appropriate level for people to, in a meaningful way, participate in the economy. And that is the income floor. So that these are important things to keep in mind, because for the first time, really, the government is acknowledging this. You know, let's say the Nova Scotia government thinks that $7,400 a year is enough for a single person to live on. The federal government is saying no, $24,000 a year. The third thing is, I think the COVID-19 has really, you know, say like, put an end to the lie that we constantly hear when we ask for basic income, and that there is no money. Because suddenly there is money galore to do what needs to be done. Now, mind you, this is a crisis, but I think for 13% of the people that live in poverty, it is a continuing crisis. And to say that there is no money to help those people is, well, you can decide how you want to call it. But the other thing that we've learned is that a basic income method is the optimal delivery system for income redistribution initiatives. And we see it here. It's very simple. You go to the web, you put your name in, you get the money. There's no need for bureaucracy. There's no need, as mentioned already, for the bureaucracy where you have to prove that you're deserving of some money, you know, and say like the Canadian Revenue Agency simply takes care of it. They look at your situation, you get the money. You don't have to show, you know, that you are living in destitution, that you're poor. There's no conditionality and so on. So that's what we learned from COVID-19. It's possible to have a basic income. And when we, you know, going to be transitioning to the new normal, we should make sure that we have a basic income in place so that we are prepared for any other crisis that exists. Now, how do you pay for a basic income? Well, the simple answer is you're already paying for it. And because you, on an individual basis, you pay X dollar per year in income tax. That goes to the federal government, and they put Y dollars a year aside for income redistribution and poverty-related costs. So in a way, you're already paying to battle basic income. Now, the problem is you're doing a real poor job at it. And with that, I mean, by us voting and so on, and the systems that we are perpetuating a very poor job of doing basic income. And you can see where it already goes to. If you look at the picture, somebody is starving to death. So what are we actually doing at the moment, what I call a poor job? Well, in Nova Scotia, for instance, Nova Scotia gets money from the federal government from that Y amount, and they use that for income assistance program, which is horrible. And they use it for poverty-related expenses like housing, health costs, family support services, you name it. And they use it for future expenses. Like, for instance, you have immediate healthcare expenses, but you also have long-term healthcare expenses because people in poverty typically develop chronic conditions. There's lost income, there's lost economic activity, there is intergenerational poverty and so on. And in the Nova Scotia, we also use part of that money to pay for things like what I call boutique payments, i.e. money that goes to small groups of people, like GST rebates, low income tax reductions, you name it, and there's a whole bunch of them. On the federal level, we're also spending out of that Y amount, we're spending on money on Canada Child Benefit Guaranteed Income, again, you name it, and again, boutique payments, the refundable and non-refundable tax credits. So how good a job do we do it? Well, for the last 50 years, you know, basically we have 13% of poverty. So we are not really doing a good job at spending that Y amount of dollars. Question is, can we do a better job with that same Y amount of dollars? And to answer that, I'm going to draw your attention to a couple of studies that have been done recently. What we used to do, by the way, is we used to say, oh yeah, we can afford a basic income because we can look at what we're paying now already at income assistance, and we can add to it the savings that we're going to have if we do, you know, in health costs and so on. These studies are taking a different approach, and they very simply say, let's look what is possible within the tax system. So the first group were economists from Queen's University. It's Robin Beautrain, Catherine Koff, and Courtney Coble. And they said, if the federal government would readdress some of the money that they use for refundable and non-refundable tax credits, what would happen? And they said, oh, look, we can have a sizable basic income. So that was shall we say, a new step in terms of using the money that we're already spending in a different way. Now, why would we want to change existing tax credits? Is because these tax credits are supposed to achieve certain goals that when you actually analyze the tax system, they're not achieving that at all. Most tax credits are supposed to redistribute income and supposed to move it from higher income levels to lower income levels. The reality actually is that most of them actually get used by the upper and middle class, and nothing goes to the lower 2 or 3 deciles. So a second group of economists did the work at the University of Manitoba, used a similar approach, but extended it and said, what if we include provincial and federal tax credits. Remember, these are these boutique monies that I talked about, like heating assistance programs and so on, you name it. Well, they said, look, we can actually, on a federal and provincial basic income, it would cost $82 billion to do it. Because let me rephrase that. They actually said, we have $82 billion available to pay for a basic income program, and it would pay something around $24,000. Now, there's a third study. For some reason, it doesn't move on. I don't know. Let me see. My screen does not seem to want to move anymore. There we go. So the third study was done by the Office of the Parliamentary Budget Officers. So now we talk about the federal government doing a study, and they were asked to come up with a costing for a basic income along the Ontario model. That was 2018. The conclusions there were that it would cost $76 billion, but since they're already moving directly money, like through the Canada Child and so on, to people, the net cost, but it still gross, will be $43.1 billion. Now, if you remember, Stevens and Simpson said, we can generate $82 billion. So definitely enough money to pay for $43 billion. So the money is there, it can be done. Adding to that, I'm going to skip to the next one. Hold on, am I losing one? No, let's see. But we can even do better. And what happened is Basic Income Canada Network decided to hire a number of these economists that wrote these papers and said, can you guys figure out what we can do if we decide what we want a basic income to be? And so we had a couple of criteria, and that report came out just in January, and I strongly recommend for people who want to know the details, go to the Canada Basic Income Canada Network website, have a look at the report, see what it says, familiarize yourself with the details. That report came out just in January, before the COVID thing, and what we did, we used the same techniques that the other articles used, and they said we want to reach a certain number of goals. We want to reduce inequality income in Canada. We want to reduce inequality between women and men. We want to prevent poverty. In other words, not start minimizing poverty, but just do away with it. And we want to provide everyone with greater income security, including middle income earners. And that's important because shifting money, let's say like to the lower income categories using the so-called negative income tax model, actually turns out that middle income people are also gonna benefit. And of course, it does mean, because it is redistribution of money, that some of the wealthiest individuals and corporations will have to start paying a little bit more taxes. So what this model did is it took 3 different options. And the third option is, for instance, what is called a universal model. And so if people ask, say like, is there a difference between a universal model? Yes and no. It can be. It depends on how you use the word universal. But we have it included here as one where everybody gets it. Ideally, say like, the one that I want to focus on right now is option 1, which is basically everybody gets it who falls below a certain income, and as you have earned income, your benefit gets reduced, like the Canada Child benefit, until eventually, I think if you're up to $60,000 incomes, you see no net effect of the benefit. So I'm going to skip over a few things, and then option one seems to have a cost of $134 billion. So that is a little bit, that's quite a bit higher than what the other studies said. But it's also a more progressive basic income that we want. We want $22,000, not $16,900 that Ontario had. We want $22,000 for everybody. We want poverty totally eradicated. You know, so it is a much richer, much more progressive one. But it has a cost of $134 billion, a gross cost. But there's also already tax transfer and resources available of $136 billion. So we can afford it. Having said that, not only can we do better, because what these studies show, we can, instead of keeping people at $7,400 a year, we can pay people $22,000 using exactly the same amount of money that we have to do. I'll be done in a minute, I think. But there is an additional bonus. What I've been talking about is gross cost without looking at what other benefits there are. Let me show you the example of the Canada Child Benefit. It costs Canadians $23 billion a year to have the Canada Child Benefit, which is a form of basic income in place. It also turns out, a study, and the link is at the bottom of the PowerPoint slide, it also turns out that the Canada Child Benefit creates $46 billion a year in the Canadian economy. So in other words, it's generating a huge amount of economic activity. It is an economic stimulator. It creates $18 billion in gross profits in businesses. It creates 450,000 full-time equivalent jobs. And you can see more of it. Sorry, let me, something. And there's other benefits and so on. But what the message is, these kinds of programs where we put money in people's hands generate economic activity that can be much more than it actually costs. So when we talked in these studies about gross cost, we look simply at static results. We don't look at dynamic results like what kind of behavior will be created, how much economic activity will be created, how much health costs are we going to be saving. In Nova Scotia alone, immediate health costs could be something like $350 million a year that we're saving. So these programs, not only can we afford them, but they could result in huge returns of investments for us. So COVID-19 is going to come to an end, and there will be a transition. It is not sort of that at the end of 4 months, suddenly everybody goes back to work. Some people will go back to work. Some people will stay unemployed for a long time. What happened with them if CERB runs out? What happens with the companies that go bankrupt? You know, say we're going to have a huge fallout of COVID-19 for the next year or two, probably. So we should transition to a basic income, which is sustainable. You know, doing emergency payouts is not sustainable. Not only does that basic income sustainable, it creates economic activity. It could quite well be the goose that lays the golden eggs for the Canadian economic recovery. And that's it for me. Thank you all. And if you have any questions, let's hear it.
Hi, Pierre. We do have some questions for you. So the first question is from Ocean. He's asking, would there be some kind of eligibility criteria? And would the benefit you're talking about cover all people, such as undocumented immigrants who are in Canada?
That's a good question, and I don't necessarily have the answer to that. Undocumented, I'm not even sure. I think the answer to that for undocumented would be that there probably is interim money available for them, and hopefully they would transition to being documented residents. And the moment you are a resident in Canada, you would qualify. And do you have to apply for it? In a way that you have to let Revenue Canada know that you want to be eligible for a basic income. That's all that is needed. No conditions, nothing else. Just the same way CERB works. Canada Revenue Agency will work out if you qualify or not. If you do qualify, how much you should be getting, etc. No more inhumane going to the welfare office and having to deal with welfare officers who have to decide if you are living with a boyfriend or not, and all those kind of things, or if you are deserving for a dietarian additional payment or not. You simply get the money. Yeah.
So we have a follow-up question. When you're comparing the CERB with the basic income, well, how is the government currently going to pay for the CERB anyway?
Yeah, I don't know, but I can what do you call it? I can speculate, and I think if I remember correctly, I've heard the government say constantly, "Oh, we are so lucky because we have put so much money aside. We can do all this without any problems. You know, compared to other countries, we are such a rich country. We can do this." And you know, still, I think it would not be sustainable in the long run. You know, say like, but keep in mind, these are not normal economical conditions and circumstances. The studies that we've talked about is looking at normal situations where we're looking at the data that Revenue Canada has about how many people are below an income level and how many are not, you know, say, etc. And based on that, we get cost estimates. So how CERB or CERB pays for it, I'm not 100% sure. I also have a feeling that whether, as Mandy said before, where there is a will, there is a way. And what CERB shows is there definitely is a way. And what we are saying, if you have the will in these circumstances, why not have the will in normal circumstances? What makes some people deserving and other people not? Why? If you, for no income for no fault of your own, you become unemployed, suddenly under today's criteria, you deserve $24,000 a year. Yet, if you were unemployed because you became disabled or whatever, hey, $8,000 a year is good enough for you. It makes no sense. Hope that helps.
Thank you very much. Emily, I'm just keeping track of new questions that are coming in, but maybe we'll have a chance to ask them a little bit later.
Yeah, I think so. I think we should keep in mind our other panelists and their contributions, and I think we budgeted lots of extra cushion time, but I think future panelists, if you can speak to the heart of your matter and you don't have to use all your 10 minutes, because I think we are generating some good discussion here. We'll just try to make time for it all, and we'll see how we go. So next we have, let me just organize my screen here. We're going to hear from Wayne McNaughton. Just checking in, Wayne, if you need extra time, I can speak more slowly, so just holler if I should do that. But Wayne is going to speak to how a basic income differs from other forms of income assistance. So Wayne is a longtime anti-poverty and anti-homelessness activist. He's the Nova Scotia representative on the board of Canada Without Poverty. He also sits on the board of Basic Income Nova Scotia. And he moved recently, within the last 2 years, from being a longtime income assistance recipient to being an old age security and guaranteed income support or income supplement recipient. So he has a sort of 3D view on this issue. So we will turn it over to Wayne when he's ready.
I'm ready now. Can you hear me?
Yes.
Okay, good. Yes, thank Thank you very much for the opportunity to speak today to the group. I'm going to focus in as much as I can on what happened when I transitioned over from being an income assistance recipient to being a recipient of the OAS and GIS. At a basic income conference about 4 years ago, I actually spoke to the idea of how much I was looking forward to turning 65. Because when I turned 65, I would finally have enough income to live on. It's already been explained a little bit, but to put a bit of a personal perspective on it, when someone is living on income assistance, it's the rates for income assistance are very, very low. They're at least 30 to 40% below any measure of the poverty line. And they've been set that way for decades. And one of the reasons is that they don't, that governments are actually afraid of raising them for a couple of reasons. One is they worry about the idea of upsetting people who are actually getting less money for working because they're only working part-time or they're only working seasonally. So why should they get less money than somebody that's on welfare, kind of thing? That kind of looking at the other guy and being jealous of the other guy. And it's compounded by the fact that welfare is so very restricted. You have so many conditions you have to meet to qualify for a welfare payment. And a lot of people simply don't qualify. People are talking right now about the restrictions on who can apply for CERB. Well, it's 10 times worse for applying for welfare. You have to be, as already been mentioned, you have to go through a very complicated process of proving that you don't have any resources currently, that you don't have sufficient income currently, and that it's by no fault of your own. You have to prove all of those things. If you have disabilities, you have to go through a long process of getting medical reports and things like that to prove you have disabilities. And you may be asked to repeat those medical reports as often as once a year. And anything that you need in the way of special help, like a diet or a telephone or things like that, you have to get a doctor's letter explaining why you need that. And that is subject to review by an internal committee at the Department of Community Services. So I was looking forward to turning 65, not just for the higher amount of money, but for having the dignity of knowing that I have a check coming in on a monthly basis. It comes to me irregardless. It's the amount is fixed. It's not, and it's basically the only change to the amount is it may go up or down. May go up or down a little bit. If I had any extra income, my guaranteed income supplement might go up or down a bit. But in general, if there is no other income, it's going to go up because all of the federal benefits, whether it's Canada Pension Plan, Old Age Security, or the GIS, are all indexed, whereas welfare is not. And the tax credits for people living in poverty are not. Those things are fixed, and they're only increased when the government deems that they want to increase them. It makes for, when you move from being on welfare to being on income, being under the GIS, OAS GIS, you have the dignity of knowing that money is coming in, you can plan on it. Don't underestimate the value of that, because it really is precarious before that. When you're on income assistance, you can have changes or you can be cut off for very simple reasons, for bureaucratic reasons. Say you didn't complete a form properly, you didn't do this, you didn't do that. So if you find yourself automatically cut off and down to zero, or people are punished because, oh, well, you didn't go for that job interview, so therefore we're going to cut you off for X number of months. And they don't just cut off the recipient of the welfare, they cut off, in many cases, the whole family, because the family is depending on that person's welfare income to pay the rent. So it's a very, the idea of a basic income is very much like a GIS, that you have an income there that is going to come in every month. You can plan your life. You can make plans, like, for example, in that sense, making plans to make long-term purchases or major purchases. I can now turn around and say, okay, I'm going to need to get, you know, a new Chesterfield, okay, or something, or a new bed because my old one is getting broken down. Okay, well, I can't do that just out of money I get in 1 month, but I can manage to keep aside a certain amount of money every month and plan to do that in 3 or 4 months' time if it's a major purchase like that. Because basically, for a change, instead of having every single dollar go out as fast as it comes in every month, because you're not getting enough on income assistance. So what does that mean? It means that you're literally living a hand-to-mouth existence. You're looking for bargains all over the place. Talk about eating healthy. You cannot eat healthy on an income assistance check, even if you're getting special diet allowances. The special diet allowances, by the way, haven't changed in over 20 years either. So what it happens is, to give a couple of particular examples, say if I want something to drink. So I go to the supermarket, I can get a 2-liter bottle of pop at the supermarket for somewhere between 99 cents and $2 and something. To get that much juice, I'm going to pay $4 or more. So what am I going to do? I'm going to buy the unhealthy pop rather than buying the juice because I can't afford to be buying that juice. And the same thing goes for so many other things, that very often the cheaper foods are not the healthy foods. You buy things that are cheaper, that are filling and hopefully somewhat tasty, and that's what you're stuck with. It was a wonderful thing when I started receiving a GIS that I could actually go to the supermarket and buy what I wanted to buy the kind of food that I desired, not be worried about, oh, am I going to have enough to pay for it? And not even having to really, I mean, you're mentally adding up, oh, well, this is going to cost in your head maybe how much you're spending, but not having to pinch every penny and worry, I've got to stick to this list that I planned out a week ahead of time that has all of the prices marked down on it, so that I can, if I don't stick to this, if I buy one more of this item, I'm going to be out of whack, and I'm not going to have enough money to get me through to the end of the month. It also means that welfare recipients usually find themselves having to do most of their grocery shopping within a few days after check day, because that money will start to disappear very fast if you don't. Now I can plan to say, okay, I'm going to buy this, but I know that certain articles will come on sale in the middle of the month. Well, I'll wait till the middle of the month and buy them then when they're on sale, because I'll still have enough money to do it. I had the experience very recently of my refrigerator breaking down. If you're on income assistance, that would be a huge major catastrophe. In my case, it was bad, but it was an inconvenience. But when it came to getting the newer fridge several days later, I was able to restock it again after throwing out the entire fridge full of goods. If you throw out a fridge full of food when you're on income assistance, that's like, it's going to take you forever to catch up again. So these kind of things contribute, and that ultimately contributes to your health, to your mental health as well as your physical health. And I think one of the things that doesn't get talked about maybe quite enough when we talk about the health benefits of a basic income is one of the ways that healthcare costs went down in these experiments that they've done already is mental health care costs went down because people needed less mental health care services. A lot of the time, because what you live when you live in poverty is you live this enormous amount of stress that is literally playing on your mental health. Another aspect of that I would mention as well is that people ask a lot of the time, and it's a legitimate question, you know, there's a lot of people, maybe some people on this call, that are making a living in jobs where their job essentially is to help people manage through their poverty and help people live in poverty to obtain what they need and so on. Social workers, but other workers as well. And we say, well, you know, if you do away with poverty, which we could, as has been pointed out, we could do away with poverty completely. It's totally possible. But if you do away with it, you know, there's still going to be a lot of work to be done on a one-to-one basis, personal basis, because poverty does cause a lot of damage to people. And I would use the example of what happened when we've closed down various institutional facilities, whether it's the residential schools or whether it's long-term facilities, whether it's institutional facilities for the developmentally challenged or the blind or the deaf. people are put out in the community, but they still need a tremendous amount of help because they've been institutionalized for so long. They've been hurt and damaged by that. So what the people that are currently working to basically just help people to get to survive poverty could also be doing the work of helping people recover from poverty or live with the effects of poverty. There's people who are victims of the system, of that institutional system, who will need help all of their lives. And I'm sure if you're working in that field, you already know some clients that are like that. They will always need help. So that will still be there, but we can refocus those resources, that human resource of helping people live through poverty, to work towards helping people overcome the effects of poverty. And I think that's something that it needs to be, that should be taken into account as well. So I hope I've given an idea of some of how this works, some of how the differences would work. Basically what happened, to put like a dollar figure on it, like has been said, I was getting approximately $1,000 a month on income assistance at the very end. My rate actually would have gone down if I stayed on income assistance because I was getting a transportation allowance that was abolished a few months after I left income assistance. And I know that's the warning bell. I'm just wrapping up here. When I moved on to GIS, OAS GIS, the purpose of that OAS GIS is to raise people up to a poverty line, at or near or slightly above the poverty line. It doesn't make you rich, but it does give you enough to live. And that's a big difference. I'm up from $1,000 a month, I've gone up over 60%. And that was an overnight change. So it's possible to do. As I say, I'm not wealthy, I'm still living, but what I would say is I'm now living a normal working class life. That's what it really amounts to. It's not that of a wealthy person, but I can do all of the modest things that most working class people can do, participate in the community the way people can. And that's huge. The impact of that will reverberate for quite a while to come, certainly for me personally, but also for anybody that is in that situation. So thank you for taking the time to listen to me, and I'm happy to answer questions.
Thank you so much, Wayne. Your perspective is really valuable to this discussion. So seems like there's been a lot of chat discussion. No, Jillian might have been synthesizing. We'll see. We do have a couple minutes to engage with the questions.
Yeah, I think there's been a bit of discussion, Wayne. I don't know if you're comfortable to address it, but just about the kind of dynamic between, if people received a universal basic income, would that motivate landlords or stores, etc., to simply raise prices? So, would the universal basic income kind of cause prices to go up, be inflationary, and then therefore the universal basic income wouldn't be worth it for the recipients?
Well, I'm not an economist, but I do know that economists have said that a basic income would not be inflationary in general. I think as far as a couple of points on that, as Mandy mentioned at the outset, there's still some other social things that we need to have in place. And one of those things is an either or for me. Either there needs to be some kind of rent control, or there needs to be more social housing built. Either one of those things would help keep a lid on exorbitant rents. That's still going to be needed one way or another. You're still going to need that. You're still going to need, for example, to have a minimum wage, and that minimum wage is going to need to be a working wage. So those things would still be needed. As far as the prices at supermarkets, I think you'd find is that, buying stuff at stores, I can't imagine why they would be raising their prices any further than they already have. The public, they don't set their prices according to what people on income assistance can afford. They set their prices according to what middle class people can afford. That's how they set their prices. They're not paying any attention to us folks on income assistance. I can guarantee you that. The only thing that they have done historically is they don't put sale items on in the week that the assistance checks or the pension checks come out. And that's a fact. Sales will not happen during that week because they know they've got a captive audience of people that just got their check and are going to go shopping. So they're not going to give you any bargains that week. You're better to hold off for a couple of weeks till they get into the bargains. Anyway.
Gillian, may I add a little bit to that inflation question?
Yes.
Because I think it is a bit of a red herring, and I agree with Wayne that sort of economic studies have shown that typical forms of basic income had no effect on inflation or labor market participation. But let me put things in perspective for a moment, why I call it a red herring. If we had a basic income in Nova Scotia, that would put $1.7 billion extra money in our economy. And people start complaining about, oh, what is this going to do to inflation and so on. I remember a couple of years ago, the Irving shipyard got $25 billion to build ships. I didn't hear anybody complain about this is going to drive inflation up. No, if anything, there were jubilant articles in the newspaper about what this would do to the Nova Scotia economy, how housing prices would go up, all those kinds of things. All the things that we worry about if we give money to poor people are a negative thing, but if we give money to the rich people, we celebrate.
That's quite. We had just a question from earlier, maybe our last question at this point would be, during COVID, some jobs have become more dangerous than they used to be. Working in an essential service, collecting garbage, or working in a store. So the question was, if jobs are dangerous to do, would people refuse to do them if they received the universal basic income, or if that was an option?
Well, I think you need to keep in mind a couple of things when we talk about basic income, and I think the key word to keep in mind is basic. What I mentioned a moment ago about the GIS, yes, I have an income that is around $1,600 a month. Even if we go with the $2,000 a month that Pierre was talking about, people are not, the majority of the population is not going to be satisfied with that. They're going to want to make more so that they can do more, because that's just enough money to get by. That's just enough money to meet your expenses. Most people want more than to just meet their expenses. So I think I think that's another red herring question a little bit.
Yep.
All right, I think we should carry on.
Absolutely. So we will hear next from Karen Foster, who's going to discuss what a basic income would mean for Nova Scotia, with a focus on rural Nova Scotia. She's a sociology professor at Dalhousie, and she holds the Canada Research Chair in Sustainable Rural Futures for Atlantic Canada, and she was one of the founding members of Basic Income Nova Scotia. We'll turn it over to Karen.
Okay, thanks. Can everyone hear me okay? I see some nods. Okay. So I don't have slides. I'm just gonna speak a little bit about what I know about rural communities that tells me that a basic income makes sense, at least in theory. So the first thing that I guess characterizes rural work is that it's more often seasonal. And that's one of the reasons why people who live in rural communities tend to use EI in greater numbers, and they use it more often than people who live in urban places. Another thing about rural communities is that key rural industries are crucial for all of us to continue on as normal. They're often seasonal, so I'm thinking about agriculture and certain natural resource extraction industries. And jobs in those industries are often hand to mouth. They can be quite fickle. But they're absolutely crucial for the rest of us. So in other words, we need people living in rural places, and we need people doing rural jobs. Rural communities have lower median incomes. They tend to have higher rates of poverty, higher rates of child poverty, and lower average levels of education. So a different workforce and a different set of jobs available to people. Rural communities also tend to have worse access to public services. A lot of the cost of service delivery to rural communities has actually been downloaded to rural individuals or households who have to pay more, for example, to drive to medical specialist appointments. We consider that they have access technically to medical specialists, but it's not because they're being met by the specialist, but that they have to drive into the nearest city. So they absorb the cost of service delivery that doesn't actually extend to rural communities. They also spend more of their time. I think time is a really important resource that we don't always think about when we talk about basic income, but it is one of the things that a basic income can bring to people is more time. Away from paid work and also away from filling out paperwork to receive benefits. So people in rural communities spend more of their time accessing public services, and it starts early. It starts in young kids who have to spend like 2 hours on a school bus to get to their public education every day. Rural economies are also affected by some major political shifts, or political economic shifts rather, that have occurred or are continuing to occur in our lifetimes. So they've seen their populations shrink thanks to urbanization. They've become increasingly reliant on global markets, both to get the stuff that they need, but also to sell their products to. So if we look at like the seafood industry in Nova Scotia, it's really reliant on exports to global markets. All of Nova Scotia is doing this, is really leaning into global markets, and all of Nova Scotia is affected by it. But rural communities are especially at risk of having their economies upended by what happens in distant markets, or by global pandemics, as we're seeing now. Rural communities are more likely to rely on a small number of industries, or maybe even one industry, so that when an industry tanks or has a bad year, the whole community goes down with it. And rural communities are increasingly putting all of their eggs into the export basket because that's what the flavor du jour is in economic development. So rural communities, I see them as being more at risk, like at a deeper level of I guess having their incomes and their income security affected by things beyond their control, shifts beyond their control. Rural people cope with these difficulties. They always have. They do so by relying to a greater extent than urban communities on EI, as I mentioned. They also engage in under-the-table work more often. People help each other out through unpaid work. They work away, for example, on the oil rigs or in the oil patches. And these strategies all help people to stay in the communities where they want to live and where we need people to live. But they're fraught with their own challenges. And I think that a basic income could help rural communities deal with their challenges better. A basic income could allow more people to stay rural because their bare survival in a place wouldn't depend on finding stable long-term employment that pays enough money to cover their costs of living. So it could roll back urbanization, maybe. I don't know of any studies that go toward proving that, but it's a hypothesis. A basic income could buffer against the risks of globalization because it could allow people to start the small risky, relatively unprofitable, but important local businesses that contribute to strong, resilient local economies, because they could take people could take entrepreneurial risks without worrying about losing all their income. And there's actually quite a bit of academic research that backs this up, that rather than pulling away from work or other income generating activities, when people have a basic income, they start to think about starting businesses, or producing things, or even working in jobs that we now think of as altruistic. So people are free to do jobs that don't pay very well, but that are personally fulfilling. So whether it's in the arts or creating a business or doing care work. On that note, I think a basic income could allow people the time away from bad low wage jobs to engage in more self-sufficient and resilient practices. So growing their own food, or even providing the unpaid care work for children and elders and people with disabilities that people now have to do on top of their jobs or be poor because of it. And again, a basic income opens up possibilities and choices, like Wayne was saying. It could put upward pressure on employers by eliminating the reserve army of labor that's ready to take on bad jobs out of desperation. It could force employers to make jobs better. In fact, it's been shown to do that in jurisdictions where basic incomes have been introduced. It may not necessarily be that wages go up, but that employers start to hire people with less education and give them on-the-job training. Or they offer more benefits, or flexible hours, or whatever makes a job attractive. Industries get creative when they know that people aren't desperate. In rural communities, there is the problem of labor shortages, and so far there's no evidence that a basic income would exacerbate labor shortages, because it doesn't disincentivize work. Our worry is always that people will just take the basic income and not go to work. But as Wayne said, it is basic. People will still want to work for luxuries. And also, we work for a lot of reasons other than pay. We work because we find it personally fulfilling. We work because it's a way to connect with the world and contribute. And so people aren't going to run away from work just because they get a basic income. I would like to see evidence about what a basic income would do to agriculture in particular, because I think that, right now our agriculture in Nova Scotia and all of Canada and really most of the world is heavily reliant on migrant labor. And so I have a question about what a basic income would do to agricultural work. Would we see employers lean into migrant labor more, or would there need to be some policy in place, that would ensure that migrant workers aren't like an escape hatch for agriculture? Then again, agriculture can't really absorb much more costs. So that's a question. It doesn't threaten my support of a basic income, but I think it's a place where there needs to be some more thought. So I guess I'll close by noting, or I guess reiterating the point around work and the basic income as a disincentive to work. I think it's not a real problem on 3 levels. First, much of our concern around basic income and work stems from a moral anxiety about what people are going to do with their free time if they don't have to work for a living. And this comes from an ingrained disdain that we have for slackers. And we tend to treat work like it's, as one of my favorite political theorists puts it, a part of the natural order rather than as a social convention. But there's nothing inherently necessary about full-time, year-round employment. It's a social convention, which means that we could do it differently. Second, basic income experiments, as I've said, have shown that people continue to work for pay even if they receive a basic income, because they get extra money, because they find it fulfilling, and because it's very hard to deprogram the idea that paid work is the cornerstone of life. We will feel bad if we don't keep working. Third, even if people ceased working for pay, they would only be refusing employment, not work per se. There is so much work that's necessary to our survival as a species that falls outside of the employment relationship, and it depends mainly still on women. And a basic income would finally acknowledge that that work has economic value. So taking care of children, elders, people with disabilities, contributing to even the volunteer economy in rural places that puts on festivals, that kind of stuff is unpaid, but having a basic income would acknowledge that there is a lot of work borne by people who don't make any money already, and they deserve to be able to survive and put food on the table and still do that work. So if we accept those reassurances, then we can see that a basic income maybe tips the balance just a little bit toward the vast majority of people who don't own companies or have inherited wealth. If a basic income is sufficient, a worker can walk from her job if the conditions aren't good enough. She can survive until she finds something else. People can also choose to live where they want to live and where we need them to live. And so I can't think of many things that erode the overwhelming power of employers and the overwhelming influence of markets in that way. I'll leave it there.
Very good.
Thank you, Karen. That was really great. So I see lots of discussion, which I'm digging into as well. I don't know if there's core questions. I think more just real grappling with your discussion of work and our relationship to it.
Could I ask a couple of questions?
Sure.
Coming in from the discussions that people are having on the chat. This I thought was kind of interesting. It's this is about how to, I guess all of these questions are about how does the introduction, what are the broader implications of the introduction of the universal basic income? So this first question is, what happens with employers when you introduce a universal basic income? Do we know from the experiments, the policy experiments that have been done, do employers, would employers react to its existence by actually lowering the wages they offer for work, knowing that people have this cushion of the basic income? Or would it have the opposite effect, and would employers want to improve working conditions and improve the wages that they're offering in order to attract, feeling a greater pressure to attract people into their workplace from this ability they have with the universal basic income? So just wondering what you think about the impact or consequences of introducing that on employers.
Yeah, I mean, I think everything that I've seen points to employers getting creative and trying to figure out how to attract people into jobs when they're not desperate. And so I do think, when you throw education and preparation into the mix, it's interesting because I think it means that the entry-level job kind of becomes a real thing again. You can bring people in at the entry level at a fairly low wage, offer them on-the-job training. It just kind of changes the structure of employment. I do think it gives, insofar as it severs the connection between income for survival and employment, it gives workers a bargaining chip. And so if you think about how unions work, they work that way, and you see wage increases and benefit increases. So I think in theory, as long as there is not that valve of workers from somewhere else who are willing to do the work at a really low wage, and the policies in place to support that kind of migration and exploitation, then I think that it would have an upward pressure on job quality. But it also, you know, if we believe that that certain types of jobs are going to become obsolete and that we're going to need fewer and fewer people working because of technological advances, then maybe a basic income is what helps us transition to a society where everybody's working less.
And I guess the follow-up question for you is just continuing on those thoughts. What's the, like, how, like, the ramifications of the basic income? It could be very profound for the values that we have in our society, and you know, what we think is a meaningful life, or you know, some of the suggestions people are coming in, you know, does this enable us to have more art, like more artistic contributions, or more political activism, or, you know, some of, you know, activities that, you know, in a market structure people might do less of because you can't, you know, acquire enough income to survive. It changes the whole dynamic of society. What do you think?
Oh yeah, and but for me there is like a chicken egg question, because it's like, you know, it has the potential to change how we relate to work, but I think we also have to do a little bit of that before, you know, in order to accept the idea that you can get paid, and that you should not be at risk of you know, of dying because you're not employed. That's the society that we live in now. Even though we have social assistance, it's not enough. People die because they're poor in Canada. Yep. And they're poor because they're not working. And so I think, like, we need to be okay with the idea that people have a right to live and to eat and to have shelter, even if they are not employed. Especially because, I shouldn't say especially because, we also have to consider that there's a lot of people who are not employed or are not sufficiently employed, but who are doing very important stuff that still work. You know, and we know actually that we have really great numbers of working poor. You know, people who are working and still can't put food on the table. So yeah, I think that we need to, like, there's a moral question, and we need to think about what we really believe is makes someone deserving of a life at all. And I think that when we start to ask those questions, especially, I really like the way Pierre put it earlier about how now we're, you know, the pandemic has made us, all of a sudden we're all sociologists. We're saying, oh, people can lose their jobs due to no fault of their own, and they need help. But most of the people who lose their jobs, like, on a daily basis before this pandemic, it was through no fault of their own. It was, you know, restructuring of their companies, or you know, a global market dries up, or a new technology emerges, or they get injured on the job. And so nothing really has changed, but it's just that we're all affected now, and suddenly we can see that there's a lot that we don't control, and that nobody's job is really secure. And so we need to have, like, a really robust safety net that doesn't make you jump through a bunch of hoops to get it. Like, we need to accept that there's a basic threshold that everyone should be able to meet. So again, I think that a basic income could change our minds, but we also kind of need to change our minds in order to accept a basic income.
If I may add to that just briefly, what COVID-19 also is showing us, at least that's some of the sounds that I hear from the IT community and so on, is that the people like Amazon and so on are realizing from COVID-19 how vulnerable they are to, shall we say, humans doing the work. Because humans get sick, and that causes a problem for them in the economy. So we may see, coming out of COVID-19, a really ramping up of the automation, and jobs may seriously disappear to, you know, let's say, to the point where we all might find ourselves unemployed, you know, say, because in a way, for the capitalist enterprise, human labor is a weakness in the system, and it's disposable.
Yeah.
And another thing that I I would just like to add, I just realized I hadn't mentioned during when I was speaking, is that when you look at the systems we have to help people that fall into these situations, one of the reasons why welfare is not a good system is, I sort of half touched on this, is that it's so hard to qualify for welfare. So even if you increase welfare to a high amount, then you have a whole lot of other working poor and so on that are not getting enough. The beauty of a basic income is it's not based on whether you're working or not. It's not based on what kind of work you're doing. It's based on, here you have a right to a certain amount of money to live, and here's that money. And that's the thing. It does separate work from income, and that would be actually a huge step forward, because that would be open the door to a lot of other changes that could be very positive.
This is all such fantastic discussion. I am regretting my moderator timekeeper role right now. I do want to protect some time for Jennifer to speak, and also Pauline. So we'll switch gears a little bit, or we'll deepen rather, and we'll hear from Jennifer, who's going to talk about how a basic income affects determinants of health and food security. She's a registered dietitian and assistant professor at Mount St. Vincent University. Her work is focused on the intersections of food, health, and social justice. So I'll pass it over to Jennifer. And I think we can still do 10 minutes. We're getting a deep processing here. And if we do some of our therefore what should we do discussion a little after 5, maybe that's okay. All right, over to you.
Thank you, Emily. I'm just gonna flip, if you could unshare your screen, I'll put my slides up so people can follow. Perfect, thank you.
Oh.
Can people see?
Yeah.
You can see my slides?
The carousel?
That is my wallpaper.
Oh.
Let me see.
Pierre, you might want to mute your computer.
Are you able to see? Oh, there we go. We're doing later. Okay. Are you able to see my slides?
Yes.
Yes? Lovely.
Yes, and somebody has a television on in the background.
All right. Thank you very much to the organizers. Like was mentioned, I'm going to drill down to a specific issue, specifically this question: how does a basic income affect determinants of health and food security? Now, the determinants of health is a huge topic in and of itself. The determinants of health, generally speaking, in broad strokes, are the economic and social conditions that shape the health of individuals, communities, and jurisdictions as a whole. So they're very wide-ranging, and generally are seen as including this list. So income, race or racism, gender, sexism, et cetera, and so forth. But what I'm going to focus on, obviously, given the discussion, is income. Income is worth focusing on, not just because our topic for today is basic income, but because income, in terms of the social terms of health, is often understood as a determinant of determinants. And the reason for that is because the effect of income on health outcomes is so strong that it often determines the way that other social terms of health play out or affect people's lives and health outcomes. And just to illustrate what I'm talking about here, one of the main concepts that's often, or that we can see illustrated very well in the data, and that others have mentioned on already, or have touched on already, is what's called the wealth health gradient. And this comes out starkly across any number of ways that we might measure health. And I'm just going to show you two that are particularly sensitive to, or particularly sensitive illustrations of health across different incomes. So just to walk you quickly through the charts I'm going to show, the cluster of bars at the top are those people earning the highest income, and it goes down in a gradient to the bottom where the last three bars, the bottom three bars there, are the cluster of those earning the lowest income quintile. So you can see quite clearly that those earning the most amount of money live longer than everybody else, and it goes down in a stepwise gradient to the bottom cluster. Those earning the least amount of money live less number of years than anybody else in any other sort of income quintile or group. Similarly, infant mortality, which is taken as a particularly sensitive measure of inequity, shows the exact same pattern. So infant mortality among those people earning the most amount of money is much lower, and then it goes stepwise in a gradient down to those earning the least amount of money. So income across essentially any other measure, mental health, addictions, cardiovascular disease, cancer, shows a pattern exactly the same, that those earning the most amount of money get cancer less often, and when they do get cancer, actually survive it at a higher rate than those earning any lesser amount of money in that sort of gradient pattern. Food insecurity obviously is tied heavily to health, both because of obviously nutrition, but also something that Wayne mentioned, which is the social deprivation associated with food insecurity. So food insecurity is related both to material deprivation, or just not having enough food, but also social deprivation and stress that's related to the ways that food serves such an important role in our lives beyond nutrition. So connecting us to our family, connecting us to spirituality, to culture. Think about the ways that food are such a, a pleasurable part of everyday life for those who can afford what they want to eat. I'm going to focus on household food insecurity in Canada, but I would also just like to mention something, or reiterate something that Karen mentioned, that basic income is also important to community food security, although there's not a lot of research on this. But when I say community food security, I'm talking about food systems. So we think about the food system in Nova Scotia, how food is produced, distributed, delivered, how it makes it to the grocery store, how it makes it to our plates. There's, I think, a lot of discussion that we could have about that too. But for now, for today, household food insecurity is what I'm going to focus on. And essentially, that's the inadequate or insecure access to food due to financial constraints. So clearly, food insecurity is very much interlinked with poverty. And I'm going to show you a few stats from the most recent data that we have on food insecurity in Canada. So the 2017-2018 data set where we pull food insecurity numbers from show that 4.4 million people in Canada were food insecure during that time. That includes over 1 million children. That equates to 1.8 million Canadian households, or 12.7% of households. Now, the thing with food insecurity is that there's different levels of food insecurity that get measured. And I just want to break that down so you understand some of the data I'm going to show later. So there's severe food insecurity, which equates to about 3% of Canadian households. And that's a level of food insecurity where people are compromising not just their quality, but their quantity of food. So they're skipping meals, sometimes for days at a time. The next level would be moderate food insecurity, where there's compromise in quality or quantity, but not so severe, not quite as severe as consistent as the severe food insecurity. And then The next level would be marginally food insecure, where people are worrying or have an income-related barrier to secure food access, but generally are still being able to afford the quantity of food that they need. So they're not going hungry. Another point from the most recent data that we have is that food insecurity is increasing consistently. The number of food insecure people we have in Canada right now is the highest it's ever been since it started being measured in 2004. And so there's been a year-on-year increase since that time. The other important thing is that Nova Scotia has persisted for the last number of years, since about 2007, as being the province with the highest rate of food insecurity at 15.7%. So we're above the national average and have been since 2007, when Newfoundland actually dropped down from being the province with the highest rate of food insecurity, and we moved into first place. And what I mentioned earlier, food insecurity means both material and social deprivation. So just to show you, food insecurity is very much tied to poverty. It's a very sensitive indicator of poverty. And as we move up income levels, food insecurity decreases. But this does speak to the point earlier that food insecurity doesn't disappear at income levels that people might expect it to. And this, I think, reiterates a point that many have made earlier, that we still require other aspects of the social safety net to address reasons why people would be food insecure at the upper levels or the sort of higher levels of middle, let's say middle income income levels, because food insecurity doesn't just disappear at those income levels. One of the really shocking things about food insecurity is that, of course, we often associate that with poverty and with social assistance. But to speak to, or to illustrate one of the points that Mandy made earlier, that this is also about the precarity of work. Most people who are food insecure in Canada, their main source of income is not social assistance. It's actually wages from work or self-employment. So the proportion of people that are food insecure, you can see here in the dark purple, the 65% portion of this chart. 65% of people who are food insecure, their main source of income, excuse me, is employment or is self-employment. The proportion of people who are food insecure that are receiving social assistance actually is quite a bit less than those who are earning, let's say, minimum wage or are working in precarious or gig economy kinds of jobs. And so from the perspective of basic income, clearly this is about solving poverty, not just increasing social assistance rates, as many would suggest we should do rather than implementing a basic income. Basic income addresses the reasons why people are food insecure across these various groups of folks, including those people that are earning income. However, for those earning social assistance, the depth of food insecurity is higher than these other groups. So over a quarter of people receiving social assistance are experiencing severe food insecurity, and then an additional quarter are experiencing moderate food insecurity. So that the depth of food insecurity among those receiving social assistance is more severe than the other groups. The other important thing about food insecurity, and the other thing that basic income addresses by addressing the root causes of food insecurity, which is poverty, is that food insecurity rates mirror other social inequalities. So food insecurity is higher among households with children, 16.2% of households with children rather than the 11.4% of households without. Household food insecurity is higher among lone parents, and then even higher for female-headed lone parent households as compared to male-headed lone parent households, obviously illustrating the way that income interacts with gender as a social determinant of health. Households with newcomers have higher rates of food insecurity, and households with less formal education have higher rates of food insecurity. And there's a number of other demographics that increase household food insecurity. I've just pulled a few important ones there. Oh, and one other one is that, as Mandy mentioned earlier, poverty is racialized, and ergo food insecurity is highly racialized. You can see here that the rates of food insecurity, of household food insecurity, much higher for particularly Black and Indigenous folks in Canada. As other people have mentioned, food insecurity or poverty is highly tied to healthcare costs. And we can see that here with this chart that more specifically illustrates the relationship between food insecurity and healthcare costs, without even looking at the different types of costs, which are the different colors of the bars. You can see that for those who are food insecure, the average cost per individual is a third of what an individual living in a severely food insecure household costs the healthcare system. And this is a result of both, as we mentioned, the material deprivation, so lack of a healthy food, lack of a nutritious diet, but also the social deprivation. The other point that I want to make, and I can't say this strongly enough, is that the dominant response we currently have in Canada to food insecurity, which is food charity, specifically food banks, simply do not work. With COVID-19, we've seen a number of politicians donating vast amounts of money to food banks because food banks have been very hard hit by COVID-19. Volunteers are unable to go in because of physical distancing, but food banks are also receiving a fraction of the donations that they would otherwise be receiving when people, toss a can in the donation bin at the grocery store. But regardless of the COVID-19 situation, which has kneecapped food banks to offer emergency food, food banks didn't work even before that. Only a quarter of those who are food insecure actually use food banks. And there's a number of reasons for this. Accessibility, lack of transportation, the limited hours of operation, folks with mobility issues, and people living in rural areas. There's thousands of food banks across Canada, but those in rural areas are more difficult to get to because of the sort of dispersion of populations. And when you're poor, having a car and keeping it on the road is a challenge. So getting to those food banks in rural areas is simply not possible. Another reason why food banks are ineffective is because of the lack of quantity, quality, and variety of foods. So they don't meet people's basic the quantity of foods they need so that they're not going hungry, but also to meet other dietary, health, religious, personal, or moral reasons that guide what we eat. Another point about food banks is that they're highly stigmatizing. All of the data on food bank use and stigma indicates that it's taken by food bank users as a sign of scraping bottom. There's a lot of shame that goes along, and that strikes at the core of people's mental health, the experience of shame and lack of autonomy in using food banks. The other thing is that nearly all food bank clients report still being food insecure, and many of those at that severe level of food insecurity. So even when people are using food banks and accessing food that way, they're still having to skip meals and go hungry because food banks do not give them enough food, let alone healthy food, but just enough calories. In the end, food banks are patently unable to address the core reason that too many people don't have enough food. This is not a food issue, this is a poverty issue. And until we redress poverty, food insecurity will continue to be a problem and will continue to grow. How do we know that a basic income will work in terms of redressing food insecurity? Essentially because basic income raises people out of poverty or addresses poverty. That's the main reason why people are food insecure. Some of the some data that illustrates this connection between raising people out of poverty and food insecurity is a case in Newfoundland, or the case of Newfoundland and Labrador. I mentioned earlier that they used to be the province with the highest food insecurity rates, but in 2007 implemented a poverty reduction strategy that, although it wasn't a basic income, it worked to redress some of the inadequacy of social assistance by raising indexed social assistance to inflation, raised it and then also indexed it to inflation. It increased things like earning exemptions, or the amount of money that people could earn before their social assistance was clawed back, increased special diet needs rates and shelter rates. And what happened is food insecurity fell significantly. So you can see that from 2007, when the policies were implemented, to 2011, food insecurity fell by 5 points, or just over 5 points. That is a huge drop in food insecurity in terms of other policies that we've seen across Canada and the way that that's impacted food insecurity. That is a tremendous drop in the rates of food insecurity. Another that's been mentioned is the universal childcare benefit. So one study, I'm not going to get into the details, but one study that examined the impact of the UCCB on food insecurity found that there was a 4.3% reduction for individuals and households who, previous to the UCCB, had yearly incomes below the population median. So with the UCCB, food insecurity fell by 4.3%. And then similarly for individuals and single parent families, the rate fell by 5.4% after receiving the UCCB. Also mentioned by Wayne, guaranteed annual income. So another study found that with the implementation of guaranteed annual income, food insecurity dropped from 43% to 16% when you compared the rates of food insecurity among 55 to 59-year-olds to those who reached the age of 65. So essentially, with what Wayne's experience was, is echoed in the data that once people are receiving old age security, food insecurity rates drop significantly. Another way that we know,
Hey, Jen,
or some
can
other,
I jump in? And we're coming up on 5, so just think about your essentials, and then
yes,
I have some time for Pauline too.
Yes, my apologies. I will just show these charts really quickly. This is from the Ontario pilot. People who started receiving basic income from the Ontario pilot reported a significantly decreased frequency of needing to skip meals because they couldn't afford food, a significant drop in food bank usage, a significant increase in their ability to afford nutritious food, and that wraps it up for me. Thank you very much.
Thank you so much. So I think we'll pause on any questions for now and just
please
translate straight into Pauline's sort of zoom out. What can we do now? And I'll just introduce her to allow her to get ready. So she's going to talk to us about how do we move forward from informing people like we've been able to do today to actually getting a basic income implemented. If you've stuck it out this long, that might have become a goal of yours. So Pauline is a counselor for District 2 in the municipality of the County of Kings here in Nova Scotia. And she has a background in psychology, sociology, and adult education. And for 10 years, she authored the Nova Scotia Child Poverty Report for the Canadian Centre for Policy Alternatives, and is a longtime anti-poverty activist, among many other things. So we'll hear from Pauline.
So I'll try to get through this as quickly as I can. But first, I do want to say thank you to Basic Income Nova Scotia, Canada Without Poverty Network, and the Canadian Centre for Policy Alternatives for all of their work. It's amazing. It's gone on for many, many years, and it gives us the information base that we need to move forward, and a particular thanks to their volunteers. So the question that I was given was, how do we move from informing people about a basic income to actually getting one? Let me see. Basically, I think, and I'll try to shorten, that we need to get ready now to seize the day. The chance to get a basic income program for Canada, I think, will never be stronger than it will be in the period immediately following this COVID-19 shutdown. And I think we need to start thinking about how we're going to get ready and our attitude towards that. So first, I think we need to continue with this attitude of optimism that's been modeled by our government during this period of time. And second, I think we need support among our neighbours for basic income guarantee. Not terribly easy tasks, but I do think that there's a very concrete way forward. We've all witnessed that part of this optimistic can-do attitude in Canada in our response to COVID. At each step, our Prime Minister has confidently promised that no one would be left behind, that we were going to get through this. And we've watched all of the opposition parties raise their hand in agreement. And we've seen Canadians' gratitude for this response in multitudes of social media posts. So I think there's good news for basic income guarantee support. And I think that it's not going to be terribly difficult to link Canada's response to COVID to a call for basic income. And I think that it's really evident in Canada's emergency response benefit. With each modification, this program expanded almost like it was in search of a basic income guarantee. You know, all of the modifications we've seen up to this week now allowing people that are on this benefit to continue to earn up to $1,000 from other income. And they've allowed seasonal workers and other precarious people that are coming off EI and maybe not going back to the job that they had hoped to also collect the emergency benefit. So in essence, we've almost witnessed a successful scramble to get a basic income in place for a wide variety of Canadians, including the self-employed. I think it created an unprecedented opportunity for us. We can point to how effective a permanent basic income guarantee would have been had it already been in place in Canada when this hit. And we know, and we're continually told, that this isn't the last pandemic, nor is this pandemic over. We could be looking at 18 months or more in dealing with this pandemic. So when we were preparing for today, Pierre said something that has really stuck with me. He said, from his perspective, from a mathematical perspective, a basic income guarantee makes perfect sense. And I think that is the message that we all need to find a way to bring forward. We can say for sure that it's easier and cheaper to administer than this piecemeal stack of targeted assistance programs, these bureaucratic programs that we currently have, that Wayne has pointed out has no dignity for the person that is in receipt of that assistance. And I think we can point to the fact that it would stabilize our economy in good and bad times. So the question is, why don't we have it? And that brings me to a second point, closing point I'd like to make today. I think we all need ways to bring our neighbours on stream. We're on this call today likely because we're convinced that there are many, many benefits of a guaranteed income for Canada. But in reality, we know, Karen has stated, that people worry about slackers. We've all heard it. You know, the fear that a universal program would do damage, would be, you know, taking money out of our pockets if we're earners and putting it into the pockets of other people that don't want to earn or don't have a capacity to earn through some fault of their own. So I think much of that attitude comes from not knowing enough about the basic income and assuming that the piecemeal set of assistance programs currently in place protects us from that kind of abuse of the system. And I think that we need to put much more work into taking the information that we got, decades of information really, and making it useful, making it into digestible bites, putting it in our own words, making it useful to businesses, useful to communities as a whole. Can you imagine what it would be like if government was hearing from chambers of commerce that they wanted a basic income guarantee for Canadians? And I think the messaging is there. Like, we can create that messaging so that we can convince those small and large business owners that this might be good for them too. This might make a much better workforce for Canada. So I think that's the challenge that we have, is to take this information and make it into a conversation that we can have with people that we know, people that we love, people that put trust in us, so that we can change the conversation from a, oh dear, there are problems with a basic income guarantee, to this is something that Canada needs and altogether possible for Canada to have, and we can move forward with optimism together with that, look at what has happened through COVID-19. And there hasn't been much chat today about the impact this would have on climate change, but we do know that people's ability to work from home, to work at a pace that isn't so breakneck, that doesn't require us to get into our cars in the morning and drive and, you know, all kinds of directions, often not able to carpool, to get to a workplace and then drive home at night, know that that has had a very detrimental impact on our planet. So there's other things that could be linked into, but the big issue for today, I think, is COVID-19 and the aftermath of that, the weeks ahead, what we can do to just leverage that towards implementing a basic income guarantee. So I'll leave it at that.
Thank you so much, Pauline. I see some folks putting some great informative links in the chat. So for basicincomecanada.org is a really good, they have many fact sheets and different things to read there from all different vantage points. Anyone has any closing questions?
That was what I was going to ask. Maybe if we had another moment for a question for Pauline, just to reflect on some of the discussion that happened over the day. And numerous people have put this question up in various forms, which is related to, like, if we have a solid case to create and finance universal basic income, then why hasn't there been the political will to do it? And how do we, or what can we do, or what further could we do to create that political will? And I know, Pauline, you said a little bit of some of the things that we could do. One of the suggestions that had come up earlier is to create some narratives about what life would be like for people, for individuals, or for communities if we had that. So also, what do you think about how to create these narratives that change the conversation?
And if I could,
sorry, Gillian, did you want me to respond to that? Was that a question for me, Gillian?
Yes, you start, and then anyone else who wants to jump in.
This is Mandy. Could I just interrupt for a second? And while Pauline's responding, do you mind stopping sharing the screen, and I'll put up a slide? I'm sorry, Pauline, I didn't mean to. Yeah.
So I think that part of what has happened to this point is that we don't have a broad enough reach. We often think of a basic income guarantee in terms of, or speak about it in terms of, the impact that it would have on individuals that have vulnerabilities. And I think there's another conversation to have in parallel to that. And I think that that is the impact that it would have on the community at large, but also on businesses, on people that we don't usually think about when we think about a basic income guarantee. We tend to focus it in a narrow corner of the work that is about improving life for individuals and for particular individuals, and that's very important. That's a huge motivator for doing it. But I think to get people on board to support this and to speak to politicians with a different voice from different corners, we've got to enlarge this conversation. I think it's crucial to enlarge the conversation. And when it happens, I think we will see momentum. And I think government has helped us enormously at this point in time by what they've done with COVID-19. But there is still that divide around we're helping people that were hardworking, deserving people that through no fault of their own have been thrown out of work. And we need to take that narrative and switch it to something that is for all of us, and to get away from this deserving, undeserving narrative, and to also show that if there is in the system, it's not as if people feel there's no abuse in the system with the system that we have right now, and we can design a much better system. You can't have a perfect system, but you can sure have something that's a lot better and probably in the long run an awful lot less costly. So I think the narrative needs to be more multifaceted, and that will get us there.
That's great. Mandy, did you want to say something? You have the last word today.
Was that, sorry, was that? Okay, I did notice that Mandy put up a slide with things that we can do and so on. And I just wanted to sort of talk about one thing, and that is talk to politicians and so on. And I think what a lot of people are worried about calling a politician and saying something to them. And added to that is, you know, A, there is this so-called esteem of the politician versus the common man. But B, is also people feel like a little bit intimidated about talking about basic income. But we all can do a very simple thing, and that is call your riding association office, you know, call your MLA, call your MP, call your, you know, party representative or whatever, and say something very simple like, hey, listen, I heard this thing about basic income. I would really like it if you guys start looking into that and do something about it, and maybe organize. Why don't you call people for basic income to come and talk to you, for instance? You don't have to put yourself on the front line, but you can let them know that there is an interest. And you don't even have to be an expert or so on. You just say, hey, I heard this thing about basic income, and why don't you guys look into it? Because I think it is good for Canada. Anyway, so that is a very simple thing. A phone call, Monday morning.
I think I would add one more thing. It's Wayne here. Is it one of the things that has been unique about COVID-19 that has never happened in a pandemic situation before, or this kind of situation, this kind of global situation before, is our ability to communicate. And in particular with social media, if you're on social media, you know, follow the politicians, provincial or federal or whatever, and reply to them. Send them a say, hey, you're doing this is great, but why don't you put a basic income in place, because that would do the job even better. You know, something as simple a message as that. And believe me, they're paying attention. I know this because I replied to one of the Prime Minister's tweets a couple of weeks ago, and actually got an acknowledgement from the PMO. Basically liked my reply long enough to be able to archive it, I guess, because the like disappeared after a day or so. But the point was, is they're archiving all of these tweets of support or tweets with opinions. That is something that is a modern function of a politician's office, is to keep record of that, the same as they keep record of emails, the same as they keep record of phone calls. And the sheer volume of that can make a big difference in terms of what way they lean on this.
And I don't have a lot to add. I think that this has been a wonderful session, and I really have appreciated everybody's talk. And we at Basic Income Nova Scotia truly appreciate the invitation to participate in the panel. So thank you so much for asking us to come. And I wanted to put up this slide. Apologies again, Pauline, for interrupting you to do so. But it provides some links that people might be interested in to learn more about basic incomes. So that they include our Facebook page, our website here in Nova Scotia, but also Basic Income Canada website, which has lots and lots of resources and information. So if you want to know more, there's places to go. So thank you again.
Yes, thank you, everybody.
Thanks everyone for listening well past time, for a wonderful, informative, very passionate panel. And yeah, I think if anyone wants to continue discussing, you're very welcome to join our monthly or weekly Monday night Zoom calls from climate circles in the Wolfville area. Anyone could join. I can post, let's see, if you email, here I'll type it in here, you can get the link to the meeting. I'll make sure that goes in.
Emily, I think you mentioned also that it is recorded and it will go on YouTube. Is it also possible for us as Basic Income to put it on our website?
Absolutely, yeah. Once we get the video all ready to go, we'll make it available to you and we'll put it, yeah, you'll be the first people we email with it. Absolutely. Any other closing thoughts you're thinking, Jillian?
Emily?
Yes?
Why don't you send an email to Cody Boyce with it as well?
Okay, great.
That's our MP, and we all could send it to our MP.
Absolutely.
Absolutely.
What a great idea.
Absolutely.
Being slow at typing.
Well.
Okay, thanks everyone. We'll close out. We can also capture the chat, I believe. There's some good discussion there. And we'll contact Karen about getting her thoughts pinned down on paper that we can share around, because there were a number of requests for that too.
It's Pauline. I think that Pierre's presentation had some very succinct, usable information for people in his slide deck. And I think the language that he used was less academic and more friendly to an everyday audience. And I'm wondering, Pierre, if there's something that could be done with that in the way of something that could get out to libraries or what have you. I know we did the Let Them Make Cake event in 2016. We had about $3,600 from that event that was for the Annapolis Valley Regional Library to create a section in all libraries in the Valley on basic income and income security. And I think that it would be possible to get something like that produced in a, maybe a mandolin kind of brochure format that could perhaps be printed by the National Union. Like, I think we have a print house that often works with us to do these kinds of things, and distributed through the regional library system. Because I do think that some people still like to get their information in a handheld written format, and it's easy to distribute that way to different organizations too. So just something to think about. I saw, as it went by, all kinds of little snippets that I thought could make a good brochure.
Yeah. I mean, I will happily work together with whoever, say if that would be a possibility, or if there is,
We have a very good graphic artist here in the valley with links to the National Union, and he did our posters for that event, and some of the materials for afterwards too, at really at no cost, because he just sent it off to their print house.
Yeah. So, Pauline, by all means, so you want to contact me, sort of see where we
Sure.
That would be great. Yeah.
Okay.
Yeah.
Thank you, Pierre.
Thank you.
Thanks, everyone.
Thank you, everyone.
Thank you, everybody. Bye now.
Thanks, everyone.